Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, obviously with going over the paperwork and I'm talking with you, the main issues going on, well, one, there's the middle back, where, I mean, you've marked off 10 out of 10, and then also like the sacrum and the low back, 10 out of 10.
Yes.
So, granted, I mean, you're having issues with the neck, the upper back, the middle back, the lower back, the knees, the ankles, you name it.
Yeah.
We're having some issues there. Okay. So I know, as you're telling me, your go-to, your original chiro that you've normally been going to has been getting up there in age, and he's about to retire. He's always done a great job for you, which is always one thing that I love to hear. But that you're now at that point where you're needing to find someone new.
Yes.
And you loved, an old school chiropractor, and now you're also finding a new school chiropractor, but with an old school technique, just my own twist to it now. So she's definitely in good hands today. Has nothing to worry about. What I want to do and what I just want to show everybody at home is just kind of what's going on. Now I know you can, so actually I'll let you tell them how you fractured your tailbone and just a little bit of background between that.
I fractured my tailbone when I was around 15 years old, and I flipped out of a swing and landed on a rock. Okay.
And then technically, so a lot of people don't realize that when you fracture, that sacrum like that, there's not like you can, if it's like your arm, you can put it in a cast, and
right.
There's no cast for your sacrum.
No, there isn't. Just a whole bunch of pillows, and you can only spend half your time standing and half your time sitting. You can't just do one or the other and stay there.
Gotcha.
And sleeping is very uncomfortable.
I could imagine, and especially if you move and roll and flip a lot, then and you put yourself into that position, you're probably
Once you get comfortable, just stay there, don't move. If you're lucky.
Now, everything was going fine. Your chiro had everything going good for a while, and then I know it was 9 months ago you gave birth.
Yes.
And that is what. So now you've been experiencing this pain for about 9 months.
Yeah.
And it came back, and it was from childbirth and pushing, and you knew with the position that they were going to get you in that you were going to experience that sacrum and that tailbone pain again.
Yeah, but it was also something I couldn't avoid either.
Correct. We needed to get the child to come out safely, so you didn't really have a choice on that.
Right, so it was, I guess you would say that it's a sacrifice you have to choose.
Yeah, but now, 9 months later, let's get you.
It was worth it. It was worth it for him. And I was like, let's get me back to normal.
Correct, yes. You need to get back to normal now. What I'm going to have you do, I'm going to have you stand up for me first.
Okay.
So I want to run through some ranges of motion and just kind of get a baseline. Now, if you were to bend forward at the waist, is there any pain, tenderness, tightness, pulling?
Yeah, I feel stiff.
Okay.
Mostly in the mid-back.
So right through here?
Kind of stops me.
Okay. Now, if you were to extend back like this.
That does not feel good. I can, but it...
Okay, so you notice when going back.
I feel like this whole center is going forward, and then this is just going backwards on the top.
Okay. So if you're lean down to one side like that.
I'm kind of stuck.
Okay.
That's further than good.
To the other side. So you're going further to that side. Okay.
I'm also right-sided, right-handed.
Okay. Now if you're to rotate over either side.
That's about as far as I can go. There.
Okay, so you can actually lean further to your left, and you can rotate more towards your left. So when you were trying to go to your right, you didn't want to go as far. And then granted, with that lateral bending, you didn't want to go that far either. Okay. Let's go ahead. We're going to check out the neck.
Okay. Just
because I know you have a little bit of everything. So if you were to look all the way up in the air, any pain, tenderness, tightness, pulling.
Right here on the back, a little bit.
So
a little bit further up. Yeah.
Okay, between the shoulder blades there.
Yeah. And then I feel stiffness right in here.
Okay. If you were to look all the way down at the floor for me, how's that? Not as bad.
Not as bad.
Okay. If you bring one ear to one shoulder.
Kind of stiff.
Okay.
Can't go any further.
To the other side.
And that's as far as I can go there too.
Okay. And then if you rotate and you look over either side, any issues with that?
A little tightness here.
Okay.
And really not so much there.
Okay. We're going to scan the body. We're going to go from the cervical spine, go all the way down, check the leg length, and then we're going to check the symmetry from the right side of the body, comparing it to the left side.
Okay.
So I'm going to palpate, just push in on the spine, the surrounding muscles and tendons. Let me know if anything is tender to the touch, okay?
It is.
Okay. So all this, even in the cervical spine, is all tender to the touch. Now we're going into the thoracic. I'm here and still all tender. And we're making our way down. Yeah. Now one thing I know you guys probably can't really notice, but when I'm pushing in just a little bit, you know, you feel her body just kind of, you know, when it gets to that spot, just tightening up. So you can tell that there are multiple areas of pain here. Okay. Okay. So let's come down here and we're going to check that leg length down. When we bring the feet together, so that left leg is pulling short quite a bit here. Now when I scan up the body, two things that I'm looking at. So our hip on the right is actually a little bit raised, but throughout the lumbar spine, right here on this left side, is actually pushing back quite a bit here. So we're going to do an adjustment so we can bring all that back even, so we can get everything in that low back completely balanced out. Now we're going to start off with the adjustment. I always like to start up top at that cervical thoracic junction here. Okay, so we're going to start with the T3 on that left side here. There it was. I know, definitely a little tense, a little tight. Once we start taking pressure off these nerves, it'll start feeling better here. There we go. Take a deep breath in and exhale out. Good. One more time, deep breath in and exhale out. There we go. So recheck that leg length. Getting better already. Now what I'm going to have you do first, because I want to fix this right here first. I want you to sit up on the table and have one leg on either side. So what I'm going to have you do, I want you to keep your thighs to the table. We're going to rotate you all the way this way. Look as far as you can over that right side for me too. There it goes. Yeah. All right here, when you were laying flat, was completely just pushing back. So what that's telling you is your body was just locked like this. So I just wanted to whoop, and bring that right back up. Now, what we're going to do, we're going to go to the sacrum. We're going to stabilize right here on the sacrum. I want you to raise that right leg up as high as you can. Any pain, tenderness, tightness with that?
Yeah.
Okay, relax that side. Raise the left side for me. How does the left side feel compared to the right?
I think the left side hurts a little bit more.
Okay. I mean, granted, both weren't good. Okay, so what I want to do first, we're going to start with the left side. We're going to do the drops in that sacrum. After, we're going to retest both sides, because it seems as if you're going to need both, but let's start with the left first. So what I want you to do, I want you to cross this foot over that foot. Good. So the table is going to pop up from below you. Okay. So what we're going to be doing, because this left side is even harder for her to raise up, that right side, granted I know both sides are bad, but what's happening, that sacrum is going a little bit more towards the right. So we want to put a clockwise rotation. We want to bring it back to midline, and then we're going to do the drops that are going P to A from posterior to anterior. So the table is going to drop from below you. Uncross and bend just this knee. So that's going to come up, yep, just like that. I'm going to bring my hand just under the knee. Good, and relax. Table's up. 2 more of those in. And 1 more of those in. There we go. Okay. I want you to raise this left leg up. From here. There we go. How does that feel?
Better.
You notice it? Alright, relax. You notice that leg going up higher now this time?
Yes.
Okay. Now though, what I want to check, I want to see how the right one's doing. So raise that right leg up for me. Still sore?
Yeah.
Okay. So now what I want to do, I want you to cross your right leg over your left. So what we're going to do, we're going to do the same thing. What's happening is on both her SI joints, there's tension, there's adhesions in those joints. And so as you guys can tell, when we did the drops on that left side, it broke up those adhesions. You saw her leg just raise up a lot easier. It was easier for her to do it in general, but there's still those adhesions on the right side. So same thing here, table's gonna come up. And 1 more. Good. What I want you to do now, I want you to raise that right leg up for me. How does that feel?
Much better.
Good. So granted, doing them at, in the moment of doing them was not the best, but I know you notice it after now. Good. I want you to lay on your side and face me. There it was. And flip to the other side. Okay. Flat on your back for me. Now, the surgeries that you have in your ankle, are they crossing the joint to the foot, or are they up higher?
They're the actual ankle.
So it is like right
Yeah,
here.
you can actually see the scar from where the surgery is on both sides. That one's on the inside, the other one's on the outside. And that one comes up because there's a plate, because that's the longer one.
This is the one, okay.
With the plate.
Alright, so I'm going to do the leg pulls. We're just going to go up. We're not going to do it at the joint. We'll do it up higher.
Okay.
So with the leg pull now, you'll feel it in the knee going into the hip.
Okay.
So I'll go from here. So just relax. Let me have your leg. Feel how that pulls on the leg there? Good. So as you can tell, I'm doing these a little lighter just because I don't want, we want you to be relaxed for this. Good. So I'm going to have you stand up. I gotcha. And I'll have you come just right in front of me, up by your side. Yep, so I'm going to bring my hands up and over, and put your hands over mine.
Okay.
I want you to fall back onto me. Squeeze your elbows together.
Okay.
Good.
Oh.
Good. Alright, I'm going to have you take a seat. So I'll have you just, so you can see, yep, right here. Good. So now we're going to go to that anterior thoracic adjustment. We're going to make sure get that last little bit of pressure off the nerves here. Okay. Take a deep breath in and exhale out for me. Good. And you can relax your arms. Now we're going to do the Y-strap.
Okay.
This is where we're going to decompress the spine from all the way up top, going down.
Okay.
Now, have you had a decompression technique ever?
Yeah.
Okay. So this is going to be very new for you,
Okay.
but this is where you're going to get the most relief. Okay.
Oh.
And breathe for me. Deep breath in through the nose, out through the mouth. And just lay there and breathe. That one right there takes so much pressure off the nerves. That's a big one.
Yeah.
You're good. Don't you worry. That's why always after that adjustment, you feel that relief, and you feel how that pressure just from all the way up top, and you don't even realize that. That was years and years of built up pressure on those nerves. I'm gonna have you just lift your head up, and we're gonna pull this out from underneath. And relax and keep breathing.
It's more of a shock to me.
Don't trust me, you're not the only one. First time I had that done, I laid there for a minute, and then I'm sitting there and I'm trying to like wiggle my toes, like, all right, can I move my toes? And then when I stood up, I was like, oh my gosh.
Wow.
Yeah, when you get it done for that first time, yeah, like you said, it's shocking.
It's definitely a shock.
So now, what I always ask every patient, how would you describe that Y-strap to someone who's never had that done before?
Oh, I don't have words to explain. Just definitely a shock. It's definitely relief.
Yeah.
Especially, like you said, it's been years of just build up. I'm like, wow.
Yeah, you probably had no idea that you needed that adjustment that badly. Yeah. Most
I
people
definitely
don't.
feel a lot of relief in the upper neck now than I had before.
Good.
I did not have that beforehand. Before I felt really squished, and now I feel like definitely stretched.
Good. I know, that's a big one. That's a powerful move.
Yeah.
Okay, so what I'm first going to have you do, we're just going to have you sit up. I'm going to have you turn face to front. I just want to relax the muscles. So you notice the difference from when you came in into now.
Oh yeah. Oh yeah.
Good. Alright, I'm going to have you stand up.
Okay.
So now in the beginning, I had you go through some of those ranges of motion.
Mm-hmm.
We'll start up top in the neck.
Okay.
When you look back like this, look up.
Oh yeah.
Do you notice a difference?
Yes.
And look all the way down for me.
I feel very relaxed and stretched.
Good. And then just like looking over either side, you're down to one side.
Oh yes. Yeah.
Okay. And then bring one ear down into the other.
Oh, I can move. I can move.
Good. Alright, now let's check the lower.
Okay.
So go slow though with this because I know this was very slow for you first. When you bend forward at the waist for me.
Oh yeah, I can definitely. Yay! This is so nice. I can stretch all my toes now. It's just nice. I can breathe as well because before I knew it was a little difficult.
A little
now
bit.
I can.
Good. See, this is how you need to feel after an adjustment.
Yes.
Good.
I don't feel like I need to stand on one side more than the other either. Something that I noticed coming in here.
You're okay.
That I was standing on one side more than the other. Now I feel the way I'm supposed to
Stand in
be.
the center.
Yes.
Good. So if anyone is ever looking to schedule an appointment, go right to the website at drjosephcipriano.com. Send us a message and, I'd love to get you in here. Have a good one, everybody.